Okay, let's just jump right in. Welcome to the deep dive, where we take your source material and really distill it down into actionable knowledge. Today's mission. It's about a topic that affects a huge number of people, but it's, rarely discussed with this kind of depth. We're talking about mastering sexual stamina and ejaculatory control.
And this is a really critical deep dive. We're tackling premature ejaculation, or PE, which is, believe it or not, the most common male sexual dysfunction. We're seeing numbers like 30 to 40% of men experiencing it at some point. Our material today covers the whole stack: behavioral training, psychological strategies, and all the latest medical guidelines.
Right, and our goal here isn't just about finding some, quick fix. We want to give you a clear, evidence-based roadmap so you can understand all the different levers, behavioral, psychological, physiological, that you can actually pull for lasting control.
And satisfaction, that's the key. But first, we have to ground this whole conversation in reality. Before we even talk about goals, let's look at the data.
Not the myths.
Exactly. The actual studies show that the average time from penetration to ejaculation for couples is about 5.4 minutes.
5.4?
Yep, and most sex therapists would say a range of, say, 7 to 13 minutes is generally considered desirable.
That one data point is so crucial because it immediately helps us define what the problem actually is. It lets us separate a real clinical issue from maybe a perception issue.
Precisely. You have clinical PE, which gets broken down into two types. There's lifelong PE, where the time has always been, under about a minute.
Always.
Always. And then acquired PE, which develops later in life and is consistently under 3 minutes. But then there's this whole other category, subjective PE.
Okay, what's that?
This is where the time might be totally normal, 5-6 minutes even, but the person feels this complete lack of control, this sense of rushing, and it causes real distress. So it's not just a stopwatch problem, it's often a psychological one.
So the distress you feel is just as important as the actual time. Okay, that makes sense. Let's start with the tools you can use right away. The physiological levers. We're going to start with breathing and the pelvic floor.
Breathing is your absolute secret weapon. It really is. It's about getting direct access to your nervous system.
How so?
Well, think about it. Shallow, rapid chest breathing, that activates your fight or flight response. The sympathetic nervous system. It ramps up muscle tension and just speeds everything up.
Wait, so this is more than just relaxing. There's a direct neurological link between your breathing and the ejaculatory reflex.
It's both. Slow, deep breathing signals safety to your brain. So we recommend something called diaphragmatic breathing for endurance. You focus on breathing slowly through your nose, say for a 4 count, and you make sure your belly expands out.
Not your chest.
Right, your belly. Then you exhale slowly through pursed lips for about 6 seconds. That pattern, it does more than just boost oxygen. It actively slows your heart rate and encourages the pelvic floor to relax. It shifts you from that sympathetic speed-up mode to a parasympathetic calm.
That sounds like the endurance strategy. But what about in the moment? When things are escalating and you feel like you're about to lose control, you need an emergency brake.
That is where a technique like box breathing is perfect. It's a very controlled cycle. You inhale for 4 counts, you hold your breath for 4, you exhale for 4, and then you stay still, lungs empty, for 4.
Okay.
And you use this when you feel that arousal hitting, say, a 7 out of 10. You just stop everything and focus only on that counting until the intensity drops back down to a manageable level.
And these kinds of techniques, they're not new, right? They have roots in ancient practices like pranayama.
Oh, absolutely. The principles are ancient, but the application here is very practical climax management. For an even faster drop in arousal, you could try the 4-7-8 technique. Inhale for 4, hold for 7, exhale completely for 8.
And for anxiety before sex.
For performance anxiety beforehand, alternate nostril breathing is fantastic for just balancing and calming the whole system.
Okay, so once you have the breath under control, the sources point directly to the physical foundation, the pelvic floor muscles. I think most people associate Kegels with, bladder control, not this.
Absolutely.
Yeah.
But the muscles that contract rhythmically during ejaculation, the bulbocavernosus and ischiocavernosus, are right there. If those muscles are weak or you have no conscious control over them, the reflex is just much harder to suppress.
So training them gives you a physical break.
A physical break, exactly.
And this is where it got, for me, really interesting. You pulled some studies showing that consistent pelvic floor muscle training, PFM training, can resolve PE in anywhere from 55 to a staggering 83% of cases.
That huge range, 55 to 83%, is fascinating in itself. The sources suggest it really depends on 2 things. Are you actually doing the exercises? And are you doing them correctly?
Right.
But even the smaller studies showed incredible results. One trial took men with an average time of just 30 seconds, and through training alone, got them to about 2 minutes. That is a life-changing improvement in control.
So if you're going to commit to this, how do you make sure you're doing them right to get closer to that 83% number?
First, you have to find the muscles. The easiest way is to try and stop the flow of urine midstream. Or, tighten the muscles you'd use to stop passing gas. That's them.
Okay, got it.
Once you've found them, our sources recommend practicing while standing up. It adds a bit of load, helps you build strength faster.
Yeah.
You do it in sets, maybe 3 times a day. 10 quick, 1-second contractions and then 10 longer holds for anywhere from 3 to 10 seconds. Consistency is absolutely everything.
So once we've got the physical side down, the breath and the muscle, the next step in, really every sex therapist playbook seems to be behavioral training.
Yeah, now we move to the classic foundational methods. The first one is the stop-start technique. It's basically systematic desensitization. The whole goal is to train your awareness of your own arousal spectrum.
So walk us through how it works. It sounds simple, but I imagine it's difficult in practice.
It is. You or your partner provide stimulation right up to the edge, that feeling of, okay, this is the point of no return. And at that exact moment, you stop everything for 30 to 60 seconds.
Until the feeling subsides.
Right, until the arousal drops way down. Then you start again. You repeat that cycle 3 or 4 times, and you only allow ejaculation on that final go. The hard part is hitting that precise point without going over. It takes a ton of self-awareness. Then there's the squeeze technique, which is a more physical interruption.
Okay.
When you feel that ejaculation is imminent, you or your partner applies really firm pressure to the coronal ridge. That's where the head of the penis meets the shaft.
Right at the tip.
Or at the base. Either works. You hold that pressure for a few seconds until the urge goes away. That squeeze temporarily dampens the neurovascular signal that triggers the whole reflex.
This brings us right to the mental game. You said it earlier, this is often the root cause, especially for that subjective PE diagnosis. The sources really seem to stress that this is often less about physical sensitivity and more about a mental race to the finish line, just fueled by anxiety.
100%. This is where strategies from cognitive behavioral therapy or CBT are so powerful. So many men fall into this mental spiral during sex. We call it surveillance mode.
Surveillance mode.
Yeah, you're just anxiously monitoring yourself. You're thinking, am I going too fast? Oh no, I'm losing control. And that very anxiety just fires up your nervous system and makes the whole thing happen faster.
So that spiral, I'm failing, actually makes you fail. The solution then is what the sources call cognitive reframing. You have to consciously interrupt that thought pattern.
You have to. You catch that anxious thought and you actively replace it. Instead of, I'm going to fail, you consciously switch to something like, okay, this is a chance to stay present and just enjoy this connection. It's an active mental interruption.
What are the best ways to anchor your mind, to get out of that hyper-vigilant mode?
Simple mindfulness practices are incredibly effective. Body scanning. For one, you just non-judgmentally move your attention through your body from your feet all the way up, focusing only on the physical sensations. No thoughts.
And visualization.
Visualization is great to do beforehand. You picture a calm, connected, relaxed encounter. You're preparing your mind for connection instead of performance.
What's so fascinating there is that it's all about shifting your attention. You're moving it away from performance, the clock, the goal, and onto sensation and connection. It just fundamentally changes the entire experience.
That's the critical flip. You stop being an anxious observer of your own body and you become a present participant.
Okay, so for people with persistent issues, where maybe these methods aren't enough, we get to medical intervention. And this is where it gets complicated. The sources highlight that the big international groups, the EAU, the AUA, the ISSM, they don't always agree.
It's very confusing because the data isn't perfectly clear. I mean, just look at the definition of lifelong PE. The ISSM says it's under 1 minute, but the AUASMSNA says it's under 2 minutes.
So the experts don't even agree on the basic definition.
Not entirely. But they do agree on the causes. It's multifactorial, it can be low serotonin, hormonal issues like hyperthyroidism, and very, very commonly performance anxiety that's often tied to erectile dysfunction, or ED.
All right, let's talk about the main pharmacological tool, SSRIs. These are antidepressants, but they work here because a known side effect is delayed orgasm.
That's right, and the sources consistently point to paroxetine as being the most potent. Studies show it can increase that latency time by 5 to 10 times.
5 to 10 times.
It's a huge increase. But there are trade-offs. It's a daily pill, and it takes 2 to 3 weeks to really kick in. And you have to be aware of potential side effects like, decreased libido or even fertility concerns, though those are typically reversible.
Okay, so that's the daily long-term option. What about an on-demand solution? The sources mentioned duloxetine.
Yes, duloxetine was the first drug made specifically for PE. It's rapid acting, you take it 1 to 3 hours before sex, and it generally increases the time by about 2.5 to 3 times.
Sounds great, but there's a catch.
The big catch is that it's not available in the US, though it is in many other countries. And there's a crucial warning. Combining duloxetine with PDE5 inhibitors, so drugs like Viagra for ED, carries a specific risk of lowering blood pressure, which is a problem because so many men have both PE and ED.
Right, so that path gets complicated fast and really needs a doctor's supervision.
Absolutely.
What about topical treatments, the numbing agents? They seem like the most straightforward fix, but they come with their own set of problems.
They do. They're basically local anesthetics like lidocaine in a spray or a cream. And they work. One study saw an increase from just over half a minute to almost 4 minutes.
Right.
But you have to be so careful. You have to wipe it off completely or use a condom because if it transfers to your partner, it can numb them. And that completely defeats the purpose of mutual pleasure.
And just quickly, the sources mention some less common options.
Very briefly, yes. Tramadol, which is a pain reliever, is sometimes used, but there are concerns about dependency.
Yeah.
And almost all the guidelines strongly warn against controversial surgical options like dorsal neurectomy. The consensus is that those are invasive and unproven.
So after this entire stack of information, breath, behavior, biology, what does it all mean? There's clearly no single silver bullet.
The takeaway couldn't be clear. The most successful approach is always multimodal. You can't just rely on one thing. It's the combination of physical training like Kegels, the psychological work, and, if needed, pharmacological support. That's what gets the best results.
And that integrated approach has to include the partner. You can't do this in a vacuum because the anxiety and distress just stay there.
It's completely non-negotiable. PE affects both people, the relationship quality, the satisfaction. So you have to have open communication. Using I statements is key. I feel anxious when we rush, instead of you make me rush. It takes away the blame.
And in a practical sense, how can a partner help with the behavioral training?
They can agree on a code word for the stop-start technique. A simple, clear phrase that signals, okay, I need to pause and breathe now. Beyond that, they should work together to just expand what sex is, take the focus off penetration. It reduces the pressure and ensures everyone is satisfied, especially since we know most women don't orgasm from penetration alone anyway.
So the goal isn't just about hitting some number on a stopwatch. It's about enhancing satisfaction for both people.
Exactly. Confidence and a feeling of control are so much more valuable than adding another minute or two to the clock.
That was an incredible deep dive. So to summarize the core takeaway here, gaining ejaculatory control is a conscious process. It's about learning to recognize and then regulate your own arousal using these simple physical tools, breath, Kegels, and combining them with that deeper mental work, maybe supported by medication if you need it.
And we just have to re-emphasize the evidence. The behavioral therapies, the physical training, when you practice them consistently, they are the backbone of lasting change, especially when you pair them with pharmacology.
So if achieving this control, the satisfaction, is really about shifting your focus from that anxious performance to being present, here's the final thought for you to explore. What small ritual can you start implementing daily, not just during sex, to prepare your mind for connection instead of surveillance? Maybe it's 5 minutes of deep breathing before you check your email, or visualizing a calm moment before a stressful meeting. That integration of presence into your daily life, that's the real challenge. It's about training your mind for control everywhere so it's ready when you need it most.